Welcome to the Functional Nurse Podcast, where we explore how nurses are transforming healthcare through functional medicine and nurse-led innovation. I'm your host, Brigitte Sager, founder of the Institute for Functional Nursing. Here, we're reclaiming our role as healers and leaders, one root cause conversation at a time. Hello, nurses, and welcome to the Functional Nurse Podcast. My name is Brigitte Sager, and I'm your host. And I have a feeling most of you guys know my guest today, but I am interviewing Dr. Terry Wahls. And I'm going to take a minute to introduce her, and then we are going to get a ton of insight from her today. I'm really excited about. Dr. Wahls is an Institute for Functional Medicine Certified Practitioner. She conducts clinical trials in the setting of multiple sclerosis. In 2018, she was awarded the Institute for Functional Medicine's Linus Pauling Award for her contributions in research, clinical care, and patient advocacy. She's the author of the Wahls Protocol, a radical new way to treat all chronic immune conditions using paleo principles, and the cookbook, the Wahls Protocol Cooking for Life. We will be including links to her studies that we're going to be talking about, her social media accounts in the show notes. So don't worry about catching the titles of everything we talk about today. And Dr. Wahls, thank you so much for joining us today. I know my audience is so excited to hear what you have to say.
And thank you for the very important work that you're doing, Brigitte. I am very pleased to be here.
Thank you. I do think most of my audience is familiar with your work, but I'd love to start with you sharing your own health story, and because I think it's just such a testament to the work that we all do.
I'm an internal medicine physician. Before becoming a physician, I was an athlete. I competed in full contact taekwondo, free sparring. I entered medical school. I thought I shouldn't let people keep trying to kick me in the head for 2 points. So I taught. I did medical school. I started having twinges of face pain during medical school. Toughed it out. It became gradually more troublesome. And then 20 years later, I developed weakness in my left leg. I see my neurologist, who says, Terry, this could be bad or really, really bad. And for the next 3 weeks, I'm going through the workup, but I'm thinking about the fact that I've had 20 years of worsening electrical face pain. And so I know I probably have a progressive condition. And I'm hoping for a rapidly fatal diagnosis because I don't want to be disabled. 3 weeks later, I hear multiple sclerosis. I do my research, find the best MS center in the country, see their best physician, take the newest drugs. 3 years later, I'm in a tilt recline wheelchair. I take mitochondrial, a form of chemotherapy. It does not help. I take Tysabri, the new biologic, does not help. I'm then switched to CellCept. I have young children now ages 8 and 11, and I have to ask myself, am I doing all that I can? I'm still mentally clear. And so I begin reading the basic science, the animal models of MS, Parkinson's, ALS, Huntington's, dementia, and decide that mitochondrial dysfunction drive disability. I create a supplement cocktail for my mitochondria. It slows my decline. I'm very grateful. By the summer of 2007, I cannot sit up anymore. I'm in a zero gravity chair with my knees higher than my nose. I'm beginning to have a little brain fog. I've been reviewing studies for the Institutional Review Board, which oversees clinical research. And I discovered a study using electrical stimulation of muscles in people who are paralyzed. And I asked my physical therapist, can I try that? He says, yes, we could definitely grow bigger muscles. I just don't know if your brain could talk to those muscles. But it gives me a test session. Hurts bad, really bad. But when it's over, I feel great. My PT says it's probably the endorphins. But we add electrical stimulation to my workouts, which by then are little itsy bitsy 10 minutes of mat exercises. Because if I do more than that, I just can't work. And then I discovered the Institute for Functional Medicine. They have a course on neuroprotection, which I take, and they have a longer list of supplements for my mitochondria, which I add. And then I have this big aha. And now I laugh at how long it took to have this aha. Like, what if I redesign the paleo diet that I've already been following for 5 years? So no grains, no legumes, no dairy. And so based on this long list of supplements. So it takes a few more months of research to figure out where those foods are in the food supply. And I redesigned this way of eating starting December 26, 2007. Now, at that time, I cannot sit up in a regular chair like this longer than 10 minutes, which meets the definition of being bedridden. I can take a couple of steps with 2 walking sticks. I, have the trigeminal neuralgia, which is getting relentlessly worse. I'm beginning to have brain fog. It's clear to me I'm on track to become bedridden by my illness, probably demented by my illness, and I would probably die ultimately with intractable pain because with MS, if you have trigeminal neuralgia, that's part of your disease process. It eventually turns permanently on, such that, in my case, light, sound triggers the pain, a breeze triggers the pain, moving my tongue once it's on triggers the pain. So once it's fully on, I can't talk because if I try to talk, it comes out like this. Uh, so really horrible for my family to watch when those flares come on.
I bet.
I start this new way of eating December 26th. By the end of January, it's clear my mental clarity is improved, my energy is improving, and my pain is less. And my physical therapist says, Terry, you're getting stronger. He has me advance my exercises to 10 minutes twice a day, then 15 minutes twice a day, then 20 minutes twice a day, then half an hour twice a day. And then he says, it takes 45 minutes of electrical stim to grow more muscles. You're weak everywhere. You can stimulate as many muscles as you have time to stimulate. And I began walking first with 2 walking sticks, then with 1, then with none. And then on Mother's Day, I'm, basically 6 months of E-stim, 5 months out my new diet. I tell my family I want to try riding my bike, which I've not done for 6 years. So we have an emergency family meeting. Jackie, my wife, tells my 16-year-old son, who's 6'5", Zach, you jog alongside the left. And she tells my 13-year-old daughter, Zebby, you jog alongside in the right, and she'll follow. We get into position. She gives the all clear. I get on my bike, and I bike around the block, And that big 16-year-old boy, he's crying. My 13-year-old girl, she's crying. Jackie's crying. And as you can tell, when I relive that moment, I still cry. Because
With your kids.
that is when the current understanding of secondary progressive MS is incomplete and how much recovery might be possible. So every day I would bike a little bit more. And then in October, Jackie says, I've signed us up for the Courage Ride. It's 18.5 miles, honey. And however far you go, it'll be wonderful. And I have to take a few breaks along the way. But I crossed that finish line. And once again, we're all crying. My kids are crying. Jackie's crying. I'm crying. And it fundamentally changes how I practice medicine. After that, I am talking to my patients about diet, about lifestyle, and it will ultimately change the research that I do. And it changes my mission in life to give people hope to realize that even if your physicians say, there's nothing I can do, my response is there is immense amount of things that we can do. We can create a healthier environment for yourselves. And you may be surprised at how much recovery of function you can achieve. And forgive me, I have to wipe my nose because I always cry when I tell the story.
Thank you for sharing that. I have 2 teenagers, so that really got me too. Like, I can only imagine not being able to do so many of those things with them, and then that moment of being able to with them is just huge.
It is huge. And I had learned in medical school, once you got to the progressive phase of MS, there is no recovery that's possible. Every one of my physicians over the 20 years of my trigeminal neuralgia, 27 years of trigeminal neuralgia, 7 years of MS had said recovery in the progressive phase is not possible. And I had done all of that not to recover because I knew recovery was not possible. I'd done all of that because my hands still worked. I could still feed myself. I could still wipe my own butt. And that's really valuable. So part of having a progressive MS is you let go of the future. You learn to take each day as it unfolds. And so even though I was walking around, I didn't know what it meant until I rode my bike. I was like, well, we don't know how much recovery might be possible. And it may
Right.
be, we don't know how close to normal I can get.
I love in what you were talking about doing your own research, you mentioned cellular health, and I talk to my students all the time about how a functional medicine is acknowledging biochemistry is important, right? Like, that we actually have to think about these things. But you saying, like, I we talk about, like, you can't compartmentalize things and say this condition, and you're looking at different paralysis, right? Like, you're looking at different research studies that aren't about MS, but you're starting at that time to connect this, like, wait a minute, these might have an underlying connection and I can use research from different areas because it's all about the mitochondria, right? Like
It's
we know that
all about the
now.
mitochondria. It's all about the microenvironment for our cells. And what struck me when I began to develop my protocols is okay, we don't have really good research to say, here's what you can do to restore MS, but there's an abundant amount of research about things, particularly in the lifestyle world, that improve health. So, a lot of research about meditation, about diet quality, about sleep, about exercise. So part of what I would ultimately learn is because when I changed how I practice medicine, I started talking about diet and lifestyle as a treatment for all these diseases I see in primary care. I was really agitating my partners, and I got called into my chief of staff office, and he said, "Terry, people are complaining. What the hell's going on?" He read me the riot act, and now fortunately, I had been sort of prepared for that. I had brought with me a handful of scientific papers, and I'd said, "Okay, here's what I'm doing and why." And he said, "But it's not the standard of care." And then I said, "Okay, I'm good with just doing standard of care, John. Send out an email to all of the faculty that we can't use the latest research to guide our therapies. We have to follow the standard of care, and of course I'll follow that." Then I sit back and I smile, and I don't smile much in meetings. So I'm smiling, and he finally says, "Okay, if anyone gets hurt, you're going through peer review." I said, "Of course, we all go through peer review when someone gets hurt." But he ultimately becomes a huge fan of my work, and he does something that I think was very, very wise. Says, "You have to quit annoying your partners. I'm going to send you to the complementary alternative medicine clinic. You're going to learn how to talk about this in the public space, in your medical record, in a way that doesn't upset your partners." And so what I learned is, and I'm sure this is probably what you're telling your nursing staff is, we're focused on creating health. I'll let my medical team partners treat disease, and I will tell my patients that you have to keep working with your medical team to treat their diseases. I'm going to help you improve the health of your cells. And then we have to watch your blood pressure, your blood sugar, adjust your meds because you may need to have your medications lowered so you're not over medicated. Because my focus is creating health. Now, that message no longer offended people. When I started saying, yep, keep seeing your primary care specialty folks so they can manage your disease, I'm going to help you create better health behaviors and better health. That's a message that's okay. And this is what I think what you do is so vital that the nursing world gets this, and they got it way ahead of the physician world. I know when my message of diet and lifestyle went out in 2008, 2009, I was banned as a speaker. The specialty world thought my message was very dangerous. I was condemned. But I also know a lot of nurses, when people were getting diagnosed with MS, would go to a patient and say, "Have you heard about Dr. Terry Wahls? Have you heard about the TED Talk?" And they would write out my name. They would write out the book, the name of the TED Talk, and give people hope. And now eventually the physicians have now come along about 15 years after the nurses, and they're beginning to say, "Have you heard of Dr. Terry Wahls?" But the nurses were on board first.
Yes, one of the things that we talk about a lot is that we learn things in nursing school, that then we move into this allopathic medical model where it's kind of made to feel like it isn't as valuable as it truly is. And functional medicine really acknowledges the power that nurses have and that I tell them,
Oh,
I'm like, maybe you can't call it functional medicine like you're talking about with your peers, but you could say, "Oh, I'm a holistic nurse. I talk about fruits and vegetables and exercise." And then they're like, "Oh, okay, we'll let her.
that's
You can
okay.
talk about vegetables."
Right. We have to understand what is the language that feels okay to the community, the space that we're in.
Yes.
And I know at the functional medicine space, when I was first operating that 2008, 2009, they leaned a lot more heavily on advanced functional medicine testing, more heavily on supplements, some on devices. When I had my transformation, I'm in the Veteran Affairs Hospital. I can't have advanced testing. I don't get any advanced supplements, but I can talk about diet and lifestyle. And what I saw was the power of story, the power of connection, the power of groups, and the power of diet and lifestyle. And I got stunning results without any advanced testing. And then when I finally was able to create my own clinic, and so I could do just a little bit of tiny testing, a CBC, lipids, 1C, vitamin D, homocysteine. And I felt like, Christmas, because suddenly I could do some lab testing and I could and now I could add a little supplement. I could add 2,000 units of vitamin D, a multivitamin, 2 grams of fish oil, and a synthetic B complex. And those were all the supplements I could use. And I got even better results. And I challenged the faculty at functional medicine to spend more time talking about modifiable lifestyle factors and behavior change, in that the vast majority of health recovery doesn't require functional medicine testing. It simply requires hope, connection, and lifestyle factors. And so I'm pleased to say functional medicine folks have gotten on board with me on that. They've gotten on board with stressing more the lifestyle factors. And I'm so pleased that they've gotten more on board with deepening the relationship with nursing staff.
Yes, absolutely. And I'm really grateful for that too. I know my students are. And they do. I know I've told you before that my students often do exactly what you said. They're like, "Have you heard of Dr. Terry Walls?" When they're patients, they tell me that. So, major impact that you've had in that community. I had talked to you at the PLMI conference. You spoke about, I want to talk about your current research, but I wanted to say to my audience, it's a lot of nurse coaches and you're talking about coaching right now. And your talk was about diet and about getting people there, right? Like that maybe we can tell them exactly the right steps that could
Yeah.
make them successful, but sometimes they need to partner with somebody. And you just brought that up. And I think you sounded like a nurse coach, like your whole time
Yes,
you were
yes.
talking.
You
Yeah.
know, and what is so lovely, so I spent years and years being a internal medicine doc, being a physician leader, really believing in the best drugs, the newest devices. And I used that, but it wasn't good enough. And it was diet and lifestyle that recovered me. And then I saw, when I started using that in my clinics with my internal medicine folks who were really very ill, that was far more effective than any of the drugs. It was shocking. And it was shocking to the residents when I taught that to the residents. They're like, oh my God, it was so shocking. So
Yep.
it transformed the way I practice medicine. It transforms the way I teach. The pharmacology can be very helpful. I still use drugs. I still can advocate for them. I can even still advocate for a very potent disease modifying drug treatments occasionally. But I am always, always, always advocating for teaching people how to create health using diet and lifestyle.
I agree about what you're saying about prescriptions. And, what you said earlier, it circles back to that is like when we're talking about it from a nursing perspective and the scope of practice of an RN is okay, what we're working on might change your blood pressure, your blood sugar. This is what signs and symptoms might look like. That you're not doing so much of advocating for medications as people come to us on them. And we're like, okay, you might actually get better. And this is what that's going to look like. And you might need to wean off of some things.
Right. We have to be very careful because if you start feeling a little lightheaded or woozy, like, oh my goodness, your blood pressure may be falling. If your mood is so much better and you're on an antidepressant, depending on which antidepressant, now I have to be mindful that I could be flipping you over into feeling a little too great, a little
Right.
hypersexual, a little hyperspendy, and making some, decisions that would not be so good. So we have to adjust your mental health meds. So we do have to be mindful of what your medication list is. And as you begin to recover, like, okay, maybe we would be appropriate to talk to the prescriber about monitoring and considering reducing some of these medications.
Yes. Now, I would love for you to tell us all about your current research. The study is called The Efficacy of Diet on Quality of Life in Multiple Sclerosis, and I would love for my participants, the audience, to
Yes,
hear more
yes.
about that.
So we are very committed to changing the standard of care, which means I need to do high quality, randomized, controlled research. We're comparing a ketogenic diet, a modified paleo diet, also basically known as the Wahls diet, to usual diet. People with relapsing remitting multiple sclerosis who are between ages of 18 and 70. willing to be randomized come to Iowa at month 0, month 3, month 24. We'll do some patient-reported outcomes on fatigue, quality of life, some clinical outcomes on walking, hand, vision function, and a no contrast MRI at baseline and month 24. It'll be 156 people. This will be the largest, longest diet study that will have been done. That includes MRIs for people with MS. You can learn more about this at terrywahls.com/MS study. We've got about 120 people in and randomized. We want to get to 156, so that means I'm looking for 35 more. It would be so helpful to have people screen, and even if they don't have relapse-remitting MS, have them complete the screening survey so they can be in our patient database, because we have new survey-based studies that we do from time to time, and they could hear about those.
And now a quick word about our sponsor, the Institute for Functional Nursing. IFN is the leading education and community platform for nurses bringing functional medicine into their practice. IFN offers everything from short, on-demand contact hour courses to the full functional nursing program, designed specifically for nurses and nurse practitioners ready to practice root cause, whole person care. If you're looking for connection and real-time learning, the Functional Nursing membership includes 4 live meetings every month where we cover case studies and have open discussions and connection. Come be a part of a movement that's redefining what it means to be a nurse. Visit fxnursing.com to learn more and join us. And now back to today's episode. I want to stress just how important this is, right? And because we're going to talk now about research more, and that this is what we need to do as a community in functional medicine, is support each other in promoting research studies that can advocate for how effective the things that we do are in larger and larger cohorts, right? Which is tricky. So I know that you are an expert in how we use this idea of, we can have these large drug companies funding studies with 20,000 participants in it, right? But it gets tricky when you're starting to do things like food and lifestyle
It is
and
hard.
using which form of magnesium and those kind of studies. So I'd love for you to share your thoughts on that.
So if you're doing a diet study, I have to take people who are willing to be randomized. Let's say they get randomized to the keto diet. So now we're going to train them on the keto diet, train them on how to measure their ketones. Or if they're in the paleo group, we'll train them on the paleo diet. If they're in the usual diet group, they get to continue eating what they want. But keep in mind that you're asking people to stop food that they're familiar with, use new recipes, and we stress that people are much more successful if they do this as a family. So now we're going to try and convince the family to eat these new foods and to try these new recipes. It is hard because most of us eat foods that we're very familiar with. We have a few recipes that we like. The average family has 10 to 15 recipes that we rotate through, and that's what we really like. We have ingredients that we like. And now I have to have you think through, okay, I really like pizza and beer on Friday. Going to have to make food swaps. If I'm still going to have pizza, I'm not going to have beer. So could I have an apple or pear cider instead? So we help people think through what, given their family's traditional preferences, how they might reimagine some of their favorite foods and favorite meals.
I've seen on your social media where you share and you'll be in your garden doing something, or, like talking about fruits and vegetables and outdoors. And I know for me personally, when I healed myself, using food and having teenagers in the house.
That's not easy.
No, you really get buy-in as people around you see you get better. But I was wondering, how was that? Were you already like a gardener and you guys were eating great, or did you have to get a lot of buy-in too with your teenagers?
So I remember I've been a vegetarian for 20 years. And then
Okay.
when I adopted the paleo diet, my kids were still pretty young. I was doing paleo. We'd have paleo at home. They could go elsewhere and eat whatever. And it was an interesting conversation when we'd go to a restaurant. So we're eating, making our good choices, and they want to order something that's not so good for them. It's an interesting question. How do you handle that? One of my families have since told me this really great concept. I should give them credit. What they did is when their teenagers wanted to make a food choice that wasn't good for them, they'd say, "Well, honey, that's fine. Did you bring the money to pay for that? Because if you want to order that, you have to pay for it now when we're ordering it because I'm only going to pay for stuff that the family agrees is good for you." And so the kids get to have their autonomy, but the parents don't have to subsidize poor diet choices.
I like
I
that.
thought that was really
That's
quite
a good
brilliant.
way.
That's quite brilliant because you want your kids to have autonomy, but you don't want to have to subsidize stupid choices.
That is a great way to say it too. So I talk often with RNs and NPs learning and practicing functional medicine about how research impacts our work. We talk about the challenges of conducting large research studies when you're practicing more personalized care like functional medicine. What are you seeing as far as like having diet research and controlling that? Are you
Oh,
because you've done a lot of studies before this
yeah,
one,
yeah,
and I heard you talk about one where you were saying, like, you just got really basic labs that were already available for people and had a
yeah.
huge impact, and so I'd like to hear more about your past research, that would be
So
wonderful.
so, super interesting. So we've done 7 clinical trials. We've looked at a Paleolithic diet, ketogenic diet, low saturated fat diets, and what we see is, and of course, usual diet. Usual diet, your quality of life continues to decline, severe fatigue, MS, progressive disease, you see decline. The keto diet, paleo diet, low saturated fat diet all lead to reduced fatigue, improved quality of life. The paleo diet has a larger effect size, and the next was the low saturated fat, and then keto. When we did a network meta-analysis of all of the diet studies that have been done thus far, and we did that in 2021, we pulled the studies at the end of May 2021. So 12 studies, 608 participants, and it was a paleo diet, low saturated fat diet, Mediterranean diet, ketogenic diet, intermittent fasting, calorie restriction, anti-inflammation diet, and usual diet. And for fatigue, the diet that was the most effective was paleo diet, followed by low saturated fat, followed by Mediterranean. And the paleo diet was about 40% more effective than Mediterranean or low saturated fat. For improving quality of life, either physical health or mental health quality of life, there were 2 diets that were effective, and it was paleo and Mediterranean. And for that, the paleo diet was twice as effective. Now, as a group, I'd say we're still pretty young in the dietary research sphere. I think we'll have it'll be worthwhile doing another network meta-analysis probably in 2027, because we'll have more studies, more information. It's exciting. I think there is more acceptance that diet really matters. I think many neurologists are more comfortable with the Mediterranean diet, and that's fine if that's what the family wants to do. I completely endorse that. If they want the diet with the best research, it's the paleo diet. But the Mediterranean diet, that's also acceptable. Now, clinically, if the person has insulin resistance, severe obesity, the ketogenic diet clinically may be better for them. So in my clinical practice, we look at all their comorbid conditions. We look at the family, and I may have an opinion about what I think is medically the best one for them. But I also stress that they'll be much more successful if they can do this as a family. And so then it's a family conversation. What are the foods that we could increase as a family? What are the foods we could decrease as a family? What are the foods we could eliminate as a family? And I'm less rigid about is it diet plan, a Mediterranean, ketogenic, a paleo diet. I'd rather talk about what foods can you add, what foods can you reduce, what can you eliminate, what movement could you add, how could we improve your sleep? And for some people, they're ready to do a big, complicated plan with lots of steps, and others need, a little small next step.
Yes, keep it as simple as possible. I think that's so valid, like, that because you spoke about this, and I wanted to mention, I don't know if you know this, but, the recordings for PLMI, for that conference I think they're available sometime this month, they said, but it's really inexpensive to go on and pay to have access to all the old recordings, and they can hear what
Oh,
everything you
yeah.
said about all this in length from the
Yeah.
past at this last conference. But I love that he makes that so affordable for everybody to access. The top experts in their field talking about their passion projects. And so I wanted to mention that, but that idea that you just said about like you can know which study might be the ideal one for somebody in your medical opinion, right? But we have to meet people where they are.
Where
And you're
they're at.
right. Like you could say, as a family, which one of these do you think is going to work for your home and all of you for you to be able to be successful?
I went at the end of my talk, I talked about what are the key questions I ask at the end of my patient encounters. And this was Professor Bill Bean. He said, when you're done with your patient visit, ask, what did you learn and what are you going to do? And what I learned was I was not a very effective teacher. I used big words. I had to make things simpler. I had to use more basic metaphors. And I also learned that some people are ready to do what I asked, and some said, hell no, I'm not doing that, doc. And they're like, well, okay. Well, what would you like to do? What could you do? Or maybe I'm the wrong person for you and I need to help you find a different physician. And it was much better to know that at the end of the visit before they left, so we could come up with a plan that they could implement, or we could acknowledge that I'm not the right person for them. And what I learned from that is doing medicine then became so much more fun because I was now my role was to educate, give people a choice, and know that we could come up with a plan that we both like, or that we couldn't, and I need to find them a different physician. And so medicine has always been very joyful for me because I'm not in conflict with my patients. I educate them, I give them options, we find a mutually agreeable solution, or we agree that I'm not the right person for them. And then I'll help them fire me and get someone who's a better fit.
Right, we can't be everything to everybody. I think that's
Correct.
a really good take-home message, and I tell my students that, I'm like, "Create a list of the other people in your community that might be the right person." You know, somebody with trauma, we're not the right person for them necessarily, right? They need to partner with an expert in that, and so sometimes we're the bridge to making the connection, "Did you know that this could have such an impact on your health? And here's an expert in that, that could help you with it."
The other thing that I acknowledge is that doing diet and lifestyle, changing that, it is hard. It takes a little more effort. And I realized that this may not be the right time, that maybe you have a spouse who's going through their own cancer diagnosis. And so it's taking all of your effort to deal with that. Or there is a financial crisis that is taking all of your resources. And so I acknowledge it. And this is hard. It may not be the right time. Come back when it is. Let us know when you want to revisit this. But if this is the right time, here's what we could do.
Yeah, and I love that. How long in healthcare did it take us to actually ask the patients what they heard and what they're like that feedback at the end of a
What
visit
did you
to
learn
see,
and what are you going to do? Those are
or
profound
did they leave
questions.
right? Because if they come back 3 months later and say, "Oh, Doctor Walls, I
I didn't
can't
do any
do
of that.
that. I can't."
I didn't do any of that. We wasted 3 months of their time and my time. If I would have known that earlier, where they said, "You know what? I can't do any of that, doc, and I think you're full
Right.
of shit." Then I'm like, "Okay, then I should get you a different practitioner," and that would be okay, would not hurt my feelings at all. But if they said, "No, I can't do that," I could have said, what do you think you could do? And maybe what they could have done is like, you know what? Instead of 3 Cokes a day, I'll do 1. That's
Yeah.
forward progress.
Well, I'm sure you have too. I've seen people feel drastically better from that, and then they're like, "Okay, what else do you got?" Like,
Correct.
"Wow, I didn't know my pain could go down that much from that one
That
change."
small change. So ideally, we have them identify a change that they feel okay about making and that we can check in on. And my preference is ideally that they can continue to work with their coach, whether it's their nurse coach or health coach, so they could keep checking in on like, okay, you know what? I got to the 1 Coke. I'm ready to go on no Cokes. And, what do you have? I'm ready to do something about movement. And so if they can have periodic check-ins with someone who can help them say, I will be the person you could check in with on meeting the goal that they mutually developed with you. Because it needs to be a goal that speaks to their heart. But it's so helpful to have someone that I could call and check in with at some frequency that says, I made it, I'm ready for the next goal, or I didn't make it, and maybe I have to adjust my goal.
Yes. And, it makes it just nurse coaching is, everybody knows that they shouldn't smoke, they shouldn't drink too much alcohol, they should exercise and eat fruits and vegetables, right? Like we can oversimplify what people should do, but getting there is hard. And that's
It's
why
very hard.
nurse coaching is huge now because people need that support. And a lot of my students will be registered nurses and I want to talk about scope of practice before we wrap up, but they'll maybe be like, "Well, I don't know if I wanna have my own practice or have my own panel of patients that I care for with lifestyle and the things we're talking about today." Some of my students are like, "Let me start. I didn't know I could do this. Let's do it." But a lot of them are also nurse coaches, and I think we have to share this workload as a community in functional medicine, and the idea of a provider saying exactly what you just said, "Here's where we'd like to get, and now partner up with this nurse coach and work through that and get there at your pace in the way that works for you and your family."
People will be much more effective. Every now and then, someone can get my book, read it, and be inspired, make a big change, and boom, they change their life. I'd say the majority of folks, certainly what I find in my clinical practice, my clinical research, that if there's some way for them to check in with a coach, with and ideally, if the coach is able to have a group forum where
Yes.
people can talk in a group in person or now with Zoom, that peer-to-peer support, really phenomenal. And so I think nurses are well trained. I imagine there's probably some additional coaching, behavior change training available to nurses, so that would enhance their skills more as well. But food, sleep, meditation, movement, meaning in life, these are things that I think our nurse coaches would be very skilled with.
That's exactly what I was gonna ask you next is, like, for specifically to multiple sclerosis, when we're talking about that specifically and a nurse is partnering with somebody. I know, I wanna mention again, I know a lot of my students and people listening work with patients that have that diagnosis, and I'd love for them to share your need for
Yeah.
participants in your study. So I wanna drive that home again, like, that would be great for our nurses to make that connection for their patients. But what is when they're starting to work with somebody that has that diagnosis, what is your, like, bare bones getting started, where would you recommend they start with somebody?
Remind them to have hope. Remind them that there are plenty of us who have MS. My symptoms began in 1980, so clearly 40 years ago. I walk, I hike, I bike, I jog, I write books, I do research. I have an absolutely rich and very full life. It's absolutely possible for people to thrive. And depending on your clinical circumstances, you can sort out where drugs fit in all of that. But addressing diet and lifestyle, we should all be doing that. And the physicians, we don't have time to teach people about diet or exercise or any of the lifestyle factors. The physicians barely have enough time to talk to them about the DMTs and the risks and the benefits. They need to hand off to someone who can answer patients' questions about. They may not understand the Mediterranean diet. They may not understand the paleo diet. They may have questions about, how much protein do I need? They may have questions about sleep. They may have questions about, well, exercise. Is it good for me or not? And the physician will say, yeah, it's important. Hopefully, I don't even know if the physicians will uniformly say
Sometimes.
that. They'll say DMTs are important. I'd say about 50-50 now, they'll say diet and lifestyle are important. And even if they do, they don't have the time and they don't have the skills. They don't have the know. They don't know. Very few know anything about diet. Shocking, but very few will know anything about diet.
Thank you for sharing that. I think that speaks to before we go, I wanted to give you an opportunity to kinda speak on to your thoughts on this. Just when we're talking if as nurses and nurse practitioners in functional medicine training, we talk about scope of practice a lot. My students research their personal scope of practice, like what state or what country do you live in? What are you allowed to do? What we have found across the board, nobody hasn't found this yet, is nurses are educators and we are 100% the advocates, we're healers. That's why we went to school in the first place typically is to empower people and to partner with them. I felt like I was coming home as a nurse learning functional medicine and hundreds of my students have written that in their comments, through the course. But a lot of the times I find as nurses work through my course, they'll say, "Oh, wow, I didn't realize how much," like, the light bulb doesn't go off for a few weeks, and then they're like, I can do this, and, this is fully within my scope of practice. Our modern lifestyle is a huge part of the problem, and we don't
Absolutely.
need medications, right? We're not deficient in medications, and so I would love for you to share your thoughts on I'm sure you have worked with lots of nurses and nurse practitioners in your career, and I would love
Correct,
for you to
correct.
just if before we wrap
Well,
up, your thoughts on
yeah.
nurses' role.
So I think it's huge. We also train nurses and health coaches in the Wahls behavior change model because the current behavior change is pre-contemplation, contemplation, preparing for action, taking action, and then sustaining action and relapse. And that's, change is hard. So we
Mhm,
created a 15-step process to help people be far more successful at adapting and sustaining change. And we admit it is hard. That's the first thing we have to do is be honest with our patients. It is hard to give up tobacco, alcohol, gambling addictions, and other deleterious stuff that we're all addicted to, sitting too much, for example. And then the next thing we ask people to do is, what is your why? If your health could improve a little bit, what would you like to be doing again? And a really insightful question is if you looked at a house and smoke was rolling out of the windows, is there something or someone that you care so deeply about that you would rush in barefoot over broken glass to go save? And often it's grandchildren, children, spouse, maybe a parent, might be a dog or a cat. Occasionally there's some, family heirlooms that you care about. And if no one has anything on that list, I send them to mental health for counseling because they aren't going to be successful with making life change if there's nothing that they care that deeply about. And it's okay for them to say, you know what? I'll work that hard because I want to save my life. That is great. For many of us, we will work that hard for our children or grandchildren or spouse. Then I can begin the conversation of, well, if your health would improve a little bit, what would you like to be doing to be more effective with your children or your grandchildren? And people might say, I'd like to take my grandchildren to the park again. My son's in high school, my daughter's in high school, and they're dating this really fine young person, and I think they're going to get married, and I want to be able to walk him or her down the aisle. That is like, oh my God, this is gold. Now they have a reason to do the work. And then we have several more steps along the way, but you have to give people a reason to do the work because we're asking them to do something that's really hard.
I think the question why is just it just explains functional medicine it comes up so much, right?
Yeah, it explains functional medicine the way you practice it, the way I practice it, because we are so. I don't lean that heavily on supplements. I don't lean that heavily on devices. I lean very heavily on helping people be successful, changing how they run their lives for themselves and their family. And that's the hardest thing. People will spend tens of thousands of dollars on testing, tens of thousands of dollars on supplements and devices because they want to do all that. They don't really want to change their diet, don't really want to change their lifestyle. They don't really want to change their sleep patterns or their exercise. And what you and I do with helping people address their lifestyle factors are what creates health, it's what will save the country.
Yeah, and we're asking why does this person have this going on? But then you were just speaking too about the why they would be motivated to
Why are you willing to do the work?
change, right? And yeah, so why is just this overarching theme where I feel like when I started nurse practitioner school and you're learning to diagnose and treat, it's the what. It's how do I name this? And then I can connect what the treatment will be. And so I love that you brought the why around to the coaching part too. It's like,
And, I get less and less interested on the formal diagnoses. I'm interested in the root causes, understanding the lifestyle factors, the mediators, the triggers. I'm interested in the symptoms of altered physiology because I focus on addressing the lifestyle factors, monitoring the symptoms of physiology. And I tell people that I'm working on treating your cells. I'll let your specialist treat your disease. and they'll do a good job of that. I'll treat yourselves, and along the way, if we're successful, we may discover that your disease quiets, and disappears. And, people will come to see me like they don't have a diagnosis yet. They're determined to get a diagnosis. They want me to make a diagnosis. And I say, you're at the wrong place. I don't make diagnoses. I work on optimizing health. And so we will do a functional medicine, kind of thoughtful look at all this. And then we'll never get to a diagnosis. And hopefully you'll never get to a diagnosis because we create a better environment for yourselves. Everything quiets down, and your health and vitality return.
I love how you said that and the idea, we're like the empowerment that we give people when we give the education and then acknowledge there's potential for them to reverse some symptoms. And sometimes, things go away.
Sometimes reverse the
Wonderful.
disease. Not always, but sometimes we do. Sometimes we
Yeah, but
entirely
sometimes we
reverse the
make their
disease.
lives easier.
So much
Right?
easier.
Like, Dr. Wahls, thank you so much for being with us today. I would like to give you a second to just anything you want to say to
Well,
nurses that are thinking about
thank
learning
you.
more
Thank you
or
for
that.
all the work that you do. You guys were underground. You embraced me 15 years ahead of the position. So thank you. I'm very, very grateful for what you are doing. Keep up the good work. Tell people about terrywahls.com and think about getting trained in the Wahls behavior change model. I think it would fit in very well to everything that you, the nursing community, are doing.
Thank you. I just appreciate you spending time with us today.
Thank you, Brigitte.
Until next time, everybody, be well. Thank you for tuning in to the Functional Nurse Podcast. If today's episode resonated with you, be sure to subscribe and leave a review. It helps other nurses find this movement. To learn more about our programs and join the community at IFM, visit fxnursing.com. Together, we're not just rethinking healthcare, we are rebuilding it from the inside out.